Do you know that a disease, once declared nearly eradicated, is making a devastating comeback? The measles outbreak is in the headlines again, sparking concerns across communities. But what we need to know to stay safe, stick around as we break down the reasons behind this surge and the simple yet powerful actions you can take to be part of the solution. Because when it comes to measles, prevention is better than cure. This is Medical Minds, where your health meets expert insights. Measles, scientifically known as rubella, is a highly contagious viral infection caused by morbillivirus. It spreads through respiratory droplets and is one of the most infectious pathogens known to medicine. To put this into perspective, one infected individual can transmit the virus to 9 out of 10 susceptible people they come into contact with. But why is it back on the radar? According to the World Health Organization, there has been 30% increase in measles cases globally in 2023 compared to 2022. Regions like Sub-Saharan Africa, Southeast Asia, and even parts of Europe are reporting large outbreaks. In the United States alone, over 600 cases have been reported this year compared to 49 in the same period a year ago. The resurgence is linked to disruptions in vaccination programs caused by the COVID-19 pandemic. An estimated 25 million children missed their first dose of the measles vaccine in 2022, creating immunity gaps worldwide. Let's talk about symptoms. After an incubation period of 7 to 14 days, measles typically manifests in stages. The prodromal phase lasts 2 to 4 days and is marked by fever, fatigue, cough, conjunctivitis, and coryza, commonly known as the 3 Cs. Koplik spots, tiny white spots inside the cheeks, appear 1 to 2 days before the rash and are pathognomonic for measles. Rash phase, a macropapillary rash, starts at the hairline and spreads downwards, lasting 5 to 7 days. Measles is not just a childhood illness. With a transient rash, it can lead to severe complications, particularly in vulnerable populations. The leading cause of measles-related mortality, especially in children under 5, is pneumonia. Encephalitis, a life-threatening inflammation of the brain, resulting in long-term neurological damage in up to 25% of survivors. Subacute sclerosing panencephalitis, a rare but fatal progressive neurological disorder that develops years after infection. Moreover, the virus causes a phenomenon called immune amnesia, weakening the immune system and increasing susceptibility to other infections for months or even years post-infection. The good news is measles is preventable. The measles, mumps, and rubella (MMR) vaccine is highly effective, providing 97% protection after 2 doses. Yet, vaccine hesitancy and misinformation have caused immunization rates to dip below the 95% threshold required for herd immunity. Recent studies published in the Vaccine Journal emphasize that countries with vaccine coverage below 90% are at the greatest risk of outbreaks. Experts urge parents to ensure their children are vaccinated on time, starting with the first dose at 12 to 15 months and the second at 4 to 6 years. So how can you protect yourself and your community? If you are unsure whether you are vaccinated, speak with your healthcare provider about testing for your immunity or getting vaccinated. Measles is airborne and can linger in a room for up to 2 hours after an infected person leaves. Share credible information to combat vaccine misinformation. Remember, vaccination is not just a personal choice, it's a public responsibility. Studies published in The Lancet highlight that achieving high vaccine coverage can prevent over 20 million deaths globally each year. We urge you to take action. If you or your children have missed routine vaccinations, schedule an appointment today. Encourage open conversations about vaccine safety in your communities. Together, we can prevent unnecessary suffering and protect future generations. Thank you for watching Medical Minds. If you found this video helpful, please like, share, and subscribe for more in-depth discussions on critical health topics. Together, let's build a healthier future.